this video, I want to talk to you some more about pain, specifically back pain, how we can try to get over it, and basically try and break the pain cycle that we talk about so often. What I mean by the pain cycle is that pain is an alarm. Pain does not mean damage. Pain means that the brain has perceived something as threatening and has given you pain as a response. So you could be doing a completely normal movement, such as bending, sitting, going from sitting to standing, and that may create pain, even just because the brain has tagged it as pain. And so what we want to do is take some movement, and we want to try and learn how to move with curiosity and not with judgment. What I mean by that is, we are so caught up in the experience of feeling pain that we lose sense of connecting with our bodies. And it's really common for anyone that suffers with long-term chronic pain that they lose awareness of their body, they don't understand how it can move, what movement feels like, and they just move and jar movements, and that's painful, that isn't right, and everything is tense, locked up, and there is never any relaxation through movement. So we want to try and promote a few things. We want to reconnect you with how your body feels when it moves in a pain-free environment. The series of exercises we're going to go through should be pain-free, and they should be extremely low intensity. It's more, in fact, it's not really an exercise. It's more just you reconnecting with your body. I want you to think of it like that. And so once we've now reconnected with our body, we want to move it in a pain-free way, and we want to do it in as a relaxed manner as possible. What we also know is that on the brain there is a map of the body, and different areas have different representations. So areas such as the hands, the lips, the tongue have a huge representation on this map because they're so important for detecting different stimulus in the world. But areas like our lower back have a very, very small representation, and so even from the off, the brain has less understanding about the area, or what we call less proprioceptive information. And so by reconnecting and experiencing how it feels when you move, you can improve the proprioceptive information about your back, which has been proven to help with any kind of back pain. So we're going to start with the first exercise, and these are going to be the most simple things you've ever done. Remember, it should not be painful at all and extremely low intensity. So the first thing you're going to do, they're very what we call novel movements. So lying on the back in a comfortable position with the knees bent up. The main thing to think about here is it is not an exercise. It's you being curious and not judging what you feel. The first thing we're going to do, and it's all very slow, is really simple. We're just going to bring one knee up to the chest, and we're going to hug it into the chest. The slower, the better. The main thing in this is for you to be mindful. What I mean by that is, you're not doing the movement and thinking about what you're going to have for dinner. You're doing the movement and taking note of how does your back feel? What sensations can you feel? Where do you feel tension? Where do you feel movement? Can you feel that as I put my hands to here, I feel there's a slight stretch through my glute, and as I bend ever so slowly, I feel that stretch move slightly. I feel the joints in my back open slightly, and as I go a little bit further, I start to feel a tiny amount of tension build up. I'm not going to judge that tension, just notice that it's there. And then I'm going to go back down, and I feel the relaxation as the leg is let off tension as it goes back down. I'm then going to repeat the same thing, and again, just what is it that I feel? I don't know, I just want to be curious and find out. I bring it up, I feel the movement, I come in through. Maybe you want to hold it and be curious and see if I breathe in this position, because very often we don't breathe, and you take some nice exhalations. Feel how the tension changes in the back. So the first one is going to be knee hugs, not for the movement principle, but for the mindfulness principle. Okay? The next thing you're going to do, put your hands on your chest, and it's a similar principle, but this time the legs are going to be rotating off to the side 45 degrees. You'll notice immediately how different it feels, and how the spine is moving in a completely different way. You just want to move 45 degrees each way. I've got a wall in the way here, so I'll show you going this way. I feel the tension through my right hip as it drops. I feel the tension in the muscles in the low back and recognise that that's normal because those muscles are contracting to create movement, and come back. Really slow, really steady, and try to feel areas of tension. Perhaps you feel slight discomfort as you go to that point. It should be no more than 3 out of 10. And just feel that if you breathe and if you go further and relax, does that discomfort fade as you go through the movement? That's the second movement I want you to try. The third thing is going to be about tilting the pelvis. So from this position, if this is the pelvis here, I'm going to ever so slightly roll forwards. What you can also think about is if my tailbone was here, it's coming up, okay? Or if the bottom of the tailbone, you push that into the table. That's going to create a relative arch in the low back, okay? Again, you're trying to just feel what is happening. If you were to describe this in a beautiful way, what would you say? You would say, as I feel the pelvis moving forwards, perhaps you feel the movement through the hip. You feel the tension build up in the low back muscles where the joints are closing off. As you hold it, perhaps it becomes a little bit more uncomfortable, and so you breathe and you relax back to a comfortable position. And then you repeat again, being mindful of how do you feel, what do you feel, and trying to understand the information, the proprioceptive information that's coming from that area. Once you've learned how to tilt forwards and understand and can connect with that movement, that's the key, we're going to go into try and roll backwards. So what that means is tucking the tailbone under. You feel a little bit of tension through the abdominals, and you feel the pelvis bone tuck under, and the low back kind of flattens into the couch. Then what you can do is you can slowly rock between the two, moving slowly backwards and forwards, feeling the tensions change, feeling stretches in different areas, and feel movement through different joints. Once you've completed all of that, what you're then going to do is you're going to move on to all fours. You want to make sure that the shoulders are, the arms are under the shoulders, not over here, and not over here, they're here. My lower back isn't collapsed or arched, it's in a neutral position, and my knee is below my hip. Not further down and not further up, it's in a neutral position there. From this position, you want to experience, feel, connect, all those words with dropping the spine through. You'll feel the extension through those joints. Again, you're not judging it as a painful and tagging it as, ow, that hurts, but instead feel and recognize, oh, that's what tension feels like. Then, as I go the other way, now I feel how that tension changes. Be really mindful and experience it, and try and stretch up as far as you can until you feel the tension pattern build up once again, and back down the other way. You may spend 20 seconds, a minute doing this in either direction, just until you learn what that movement feels like. Remember, it's not an exercise, it's as if you've never moved before and you're learning how to move. From there then, what you're going to try and do is move in a different way. I'm going to take my left shoulder and I'm going to try and move it down towards my left hip, or as if I was going to put my shoulder in my pocket. And the other way. Moving it in a side motion. And experience how that feels different to the one you did before. After that then, you're going to take an arm and you're going to reach under and drop through. And again, feel the difference, feel the tension in different places as you move through those different patterns. So I hope that's helpful. Remember, this isn't an exercise. It might be a 10-15 minute session, really calm, relaxed environment. Remember to breathe and learn to reconnect with your body, which is going to be amazing at helping reduce pain.